Pancreatic cancer, empowering awareness and understanding. Pancreatic cancer is a formidable adversary in the realm of oncology, presenting significant challenges for both patients and healthcare professionals. This comprehensive guide aims to shed light on various aspects of pancreatic cancer, including its causes, risk factors, symptoms, diagnostic methods, prevention strategies, and treatment options. By delving into the intricacies of this disease, we hope to empower individuals with knowledge that may contribute to early detection and improved outcomes. Understanding pancreatic cancer. Anatomy and function of the pancreas. The pancreas is a crucial organ with dual functions, playing a vital role in both the endocrine and exocrine systems. It is located behind the stomach, nestled between the spleen and the duodenum, the first section of the small intestine. Its unique structure and multifaceted functions contribute to its significance in maintaining overall health. Exocrine function. Pancreatic ducts and enzyme secretion. The exocrine function of the pancreas primarily involves the secretion of digestive enzymes that aid in the breakdown of carbohydrates, proteins, and fats in the small intestine. The pancreas has ducts, including the main pancreatic duct, which carries digestive juices produced by the pancreatic acinar cells. These digestive enzymes, including amylase, lipase, and proteases, are essential for the digestion and absorption of nutrients in the intestines. Role in digestion. As ingested food enters the duodenum from the stomach, the pancreas releases its digestive enzymes into the small intestine. These enzymes facilitate the process of breaking down complex nutrients into simpler forms, allowing for their absorption into the bloodstream. This exocrine function is crucial for proper nutrient utilization and overall metabolic processes. Endocrine function. Islets of Langerhans. The endocrine function of the pancreas is associated with specialized clusters of cells, called the islets of Langerhans, scattered throughout the organ. These islets consist of different cell types, including alpha cells, beta cells, and delta cells, each producing distinct hormones. Insulin production. Beta cells. Beta cells are responsible for the synthesis and secretion of insulin, a hormone crucial for regulating blood sugar levels. When blood glucose levels rise, such as after a meal, insulin is released into the bloodstream. Insulin facilitates the uptake of glucose by cells, promoting its storage as glycogen in the liver and muscles, thereby lowering blood glucose levels. Glucagon production. Alpha cells. Alpha cells produce glucagon, a hormone that has the opposite effect of insulin. When blood sugar levels drop, as between meals or during physical activity, glucagon is released. It stimulates the breakdown of glycogen in the liver, releasing glucose into the bloodstream to maintain energy levels. Other hormones. Delta cells. Delta cells in the islets of Langerhans produce somatostatin, which regulates the release of both insulin and glucagon, contributing to the overall balance of blood glucose levels. Blood supply and nervous control. Rich vascularization. The pancreas is highly vascularized, receiving a rich blood supply from both the pancreatic duodenal artery and the splenic artery. This ensures that the hormones and enzymes produced by the pancreas are efficiently transported to their target tissues and organs. Nervous regulation. The pancreas is under the influence of both the autonomic nervous system and hormones. Nervous control, mediated through the vagus nerve, helps coordinate the release of digestive enzymes and hormones in response to food intake and metabolic demands. Types of pancreatic cancer. Pancreatic cancer is a complex disease with different types, each characterized by distinct features, origins, and behaviors. The two main types of pancreatic cancer are exocrine tumors and endocrine tumors. Exocrine pancreatic cancer. Exocrine tumors are more prevalent, accounting for approximately 95% of all pancreatic cancers. The majority of exocrine pancreatic cancers are adenocarcinomas, arising from the ducts of the pancreas. These tumors typically infiltrate nearby tissues and organs, making early detection challenging. Adenocarcinomas often develop in the head of the pancreas and can cause symptoms such as jaundice, abdominal pain, and weight loss. Pancreatic adenocarcinoma. Pancreatic adenocarcinoma is the most common type of exocrine pancreatic cancer. It usually arises in the ducts of the pancreas and tends to grow and spread rapidly. Early symptoms are often subtle, contributing to late-stage diagnoses. Adenosquamous carcinoma. This is a rare variant of pancreatic cancer that has characteristics of both adenocarcinoma and squamous cell carcinoma. It is known for its aggressive nature and resistance to conventional therapies. Colloid carcinoma. Colloid carcinoma, also known as mucinous non-cystic carcinoma, is a rare subtype that produces mucin, a slimy substance. It tends to have a better prognosis compared to other types of pancreatic cancer. Endocrine pancreatic cancer, pancreatic neuroendocrine tumors, endocrine tumors, ORNs, are less common but can be functionally active, producing hormones that cause specific symptoms. These tumors arise from the pancreatic cells responsible for hormone production and are often classified as either functional or non-functional. Insulinomas. Insulinomas are functional tumors that produce excess insulin, leading to hypoglycemia, low blood sugar. Symptoms may include confusion, dizziness, and fainting. Surgical removal is often curative. Gastrinomas. Gastrinomas produce excess gastrin, leading to the formation of stomach ulcers. This condition is associated with a syndrome known as Zollinger-Ellison syndrome. Surgical removal and medications to reduce stomach acid are common treatments. Glucagonomas. Glucagonomas cause overproduction of glucagon, leading to symptoms such as skin rash, weight loss, and diabetes. Surgical removal and management of associated symptoms are key in treatment. Somatostadenomas. Somatostadenomas produce excess somatostatin, leading to symptoms such as diarrhea, gallstones, and diabetes. Treatment involves surgery and symptom management. Non-functionals. Non-functionals do not produce significant amounts of hormones, making them challenging to diagnose early. They are often discovered incidentally during imaging for unrelated conditions. Treatment involves surgical removal and other interventions based on the tumor's characteristics. Causes and risk factors. Understanding the causes and risk factors associated with pancreatic cancer is crucial for both prevention and early detection. While the exact cause of pancreatic cancer is often challenging to pinpoint, several factors have been identified that may contribute to an increased risk of developing this disease. Age. Advancing age is a significant risk factor for pancreatic cancer. The majority of individuals diagnosed with pancreatic cancer are over the age of 60, with the risk increasing with each decade of life. Tobacco use. Cigarette smoking is a well-established risk factor for pancreatic cancer. Smokers are at least twice as likely to develop pancreatic cancer compared to non-smokers. The risk decreases after quitting, but a considerable risk persists for many years. Family history and genetics. Individuals with a family history of pancreatic cancer are at a higher risk, indicating a potential genetic predisposition. Specific genetic syndromes, such as hereditary pancreatitis, Peutz-Jeghers syndrome, and Lynch syndrome, are associated with an elevated risk of developing pancreatic cancer. Chronic pancreatitis. Long-term inflammation of the pancreas, known as chronic pancreatitis, is a risk factor for pancreatic cancer. This condition can be caused by alcohol consumption, certain genetic conditions, or other unknown factors. Diabetes. People with long-standing diabetes have an increased risk of developing pancreatic cancer. The relationship between diabetes and pancreatic cancer is complex, as diabetes can be both a risk factor and an early symptom of the disease. Obesity. Obesity is a modifiable risk factor for pancreatic cancer. Research suggests that excess body weight, particularly obesity around the abdomen, may contribute to an elevated risk. Dietary factors. Certain dietary choices may influence the risk of pancreatic cancer. Diets high in red and processed meats, as well as low intake of fruits and vegetables, have been associated with an increased risk. Occupational exposures. Some occupational exposures to certain chemicals, such as those found in pesticides, dyes, and petrochemicals, have been studied as potential risk factors for pancreatic cancer. However, the evidence is not conclusive, and further research is needed. Race and ethnicity. Pancreatic cancer rates vary among different racial and ethnic groups. African Americans are at a slightly higher risk than Caucasians, while Asian Americans and Native Americans have a lower risk. Gender. Men are generally at a slightly higher risk of developing pancreatic cancer than women. The reasons for this gender difference are not fully understood and may involve a combination of genetic and hormonal factors. Recognizing the signs and symptoms. Early symptoms. Abdominal pain. Dull, aching pain in the upper abdomen or back may occur in the early stages of pancreatic cancer. This pain can be persistent and may worsen after eating or lying down. Unexplained weight loss. Unintended weight loss is a common early symptom. Individuals may experience a noticeable reduction in weight without changes in diet or physical activity. Loss of appetite. A decreased desire to eat, even when food is normally appealing, can be an early sign of pancreatic cancer. Digestive issues. Changes in bowel habits, such as diarrhea or pale, greasy stools, may occur due to disruptions in the digestive process. Jaundice. Yellowing of the skin and eyes, jaundice, is a significant indicator. It occurs when a tumor in the head of the pancreas obstructs the bile duct, causing a buildup of bilirubin in the blood. New onset diabetes. Diabetes that develops suddenly without an apparent cause may be linked to pancreatic cancer. The tumor can affect insulin production and glucose metabolism. Advanced symptoms. Severe abdominal pain. As the cancer progresses, abdominal pain may become more severe and persistent. It can radiate to the back and worsen with movement or eating. Jaundice. In advanced stages, jaundice can become more pronounced, leading to darker urine, pale stools, and itching. Digestive and bowel issues. Persistent digestive issues may worsen, leading to difficulties in digesting food, nausea, vomiting, and changes in bowel habits. Ascites. The accumulation of fluid in the abdominal cavity, known as ascites, can cause abdominal swelling and discomfort. Blood clotting issues. Pancreatic cancer can interfere with blood clotting mechanisms, leading to an increased risk of blood clots, deep vein thrombosis, DVT, and pulmonary embolism. Fatigue and weakness. Ongoing fatigue, weakness, and a general decline in energy levels are common in advanced stages of pancreatic cancer. Loss of muscle mass. Advanced pancreatic cancer may result in the wasting away of muscle tissue, contributing to weakness and physical debilitation. Depression and anxiety. Dealing with the physical and emotional challenges of advanced pancreatic cancer can contribute to psychological symptoms, including depression and anxiety. Diagnosing pancreatic cancer. Imaging techniques. CT scans, computed tomography. CT scans are instrumental in visualizing the pancreas and surrounding structures. They can help identify tumors, determine their size, and assess the extent of local and distant spread. MRI, magnetic resonance imaging. MRI provides detailed images of the pancreas, aiding in the detection of tumors and assessment of nearby blood vessels. It is particularly useful for evaluating the relationship between the tumor and critical structures. Endoscopic ultrasound, EUS, involves the use of an endoscope equipped with an ultrasound probe. This technique allows for precise imaging of the pancreas and nearby structures, providing valuable information for diagnosis and staging. Biopsy and laboratory tests. Fine needle aspiration, FNA, biopsy. FNA involves using a thin needle to extract a small tissue sample from the pancreatic tumor. This sample is then analyzed under a microscope to confirm the presence of cancer cells. Blood tests. Blood tests may be conducted to assess levels of certain tumor markers, such as CA19-9. Elevated levels of these markers may indicate the presence of pancreatic cancer, though they are not definitive diagnostic tools. Laparoscopy. In some cases, a laparoscopy may be performed to obtain direct visual confirmation of the tumor and to collect additional tissue samples for analysis. Biopsy analysis. Tissue obtained from biopsies is analyzed for characteristics such as tumor type, grade, and genetic markers. This information is crucial for determining the most appropriate treatment plan. Preventive measures. Lifestyle modifications. Balanced diet. Encourage a diet rich in fruits, vegetables, and whole grains, while limiting processed foods and saturated fats. A healthy diet supports overall well-being and may contribute to a reduced risk of pancreatic cancer. Regular exercise. Physical activity is associated with numerous health benefits and may contribute to a lower risk of developing pancreatic cancer. Aim for at least 150 minutes of moderate intensity exercise per week. Tobacco and alcohol avoidance. Advocate for the avoidance of tobacco products and excessive alcohol consumption, as both are significant risk factors for pancreatic cancer. Genetic counseling. Identifying hereditary risk factors. Genetic counseling is essential for individuals with a family history of pancreatic cancer. It involves assessing familial risk factors and, if necessary, genetic testing to identify specific gene mutations associated with an increased risk. Risk management. Genetic counseling provides valuable information for developing personalized risk management plans, including increased surveillance, preventive measures, and early intervention strategies. Treatment options. Surgery. Pancreatic duodenectomy, Whipple procedure. The Whipple procedure involves the removal of the head of the pancreas, the gallbladder, part of the stomach, the duodenum, and nearby lymph nodes. It is a complex surgery often performed with the goal of complete tumor removal. Distal pancreatectomy. This procedure involves removing the tail and body of the pancreas. It may be recommended for tumors located in the body or tail of the pancreas. Chemotherapy and radiation. Chemotherapy. Chemotherapy involves the use of drugs to target and kill cancer cells. It may be administered before or after surgery, depending on the stage and extent of the disease. Radiation therapy. Radiation therapy utilizes high-energy beams to target and destroy cancer cells. It may be used in conjunction with surgery or as a primary treatment in certain cases. Targeted therapies. Specific molecular pathways. Targeted therapies focus on specific molecular pathways involved in the growth and survival of cancer cells. These therapies aim to interrupt these pathways, providing a more precise and effective treatment approach. Immunotherapy. Harnessing the immune system. Immunotherapy stimulates the body's immune system to recognize and attack cancer cells. Emerging research is exploring the potential of immunotherapy in treating pancreatic cancer. Supportive care and quality of life. Palliative care. Symptom management. Palliative care focuses on managing symptoms and improving the quality of life for individuals with advanced pancreatic cancer. It addresses pain, nausea, fatigue, and other challenges associated with the disease. Holistic support. Palliative care teams provide holistic support, addressing the physical, emotional, and spiritual aspects of care. This can enhance overall well-being and help individuals maintain the best possible quality of life. Emotional and psychological support. Counseling and support groups recognize the emotional toll of pancreatic cancer and emphasize the importance of mental health support. Counseling, support groups, and psychological interventions can help patients and their families cope with the challenges of the disease. Patient and family education. Provide information and resources to educate patients and their families about the disease, treatment options, and available support services. Informed individuals are better equipped to navigate the complexities of pancreatic cancer and make informed decisions about their care. Your health matters. Quali.health